Good morning guys and welcome back to our channel. Today is going to be a little bit different kasi hindi siya travel vlog, hindi siya food vlog, and it's going to be a sit-down vlog. A very, I hope, informative vlog for you guys. So we will be talking about today a very important procedure that you have to undergo, one of the many procedures that you have to undergo when you are an expecting mom. Okay, so today's topic is going to be, as the title mentions, OGTT or oral glucose tolerance test. So I'm creating this vlog because I wanted to educate you guys, because not until then na nirecommend kami to take the OGTT, we will never know what it means and why it is very important for an expecting mom to undergo this kind of test. I actually prepared a presentation for you guys para maging structured ang discussion natin for today. Ito, ginawa ko to in one of the days na nag-aantay ako kay Joanne sa office niya. So I created a PowerPoint presentation to serve as a guide when I discuss to you what OGTT means. Everything is based on research and experience. I'm not a doctor, I'm not a medical practitioner, so bear with me with the medical terms. Everything is based again on research, and I will link and also give you the information on which site I got some of the description, some of the procedures, and the definition itself. Alright? So first and foremost, let me just give you a little bit of background on how we were referred to by our doctor to undergo the OGTT examination. So it was then March 2, that's a Saturday, during our checkup with our OB-GYN, si Dr. May Siki Yang, our OB-GYN in Makati Medical Center. Right after our congenital anomaly scan, she referred us to undergo the OGTT. So yung referral namin for the lab department, we were referred going back. So we had the referral to the lab department for the OGTT test on March 11, 2019. So ano nga ba? What is OGTT? Let me just read the exact technical definition of OGTT coming from our source, medicinenet.com. OGTT, or oral glucose tolerance test, is a medical test in which glucose is given and blood samples taken afterward determine how quickly it is cleared from the blood. So this procedure will let you know if you have an existing or experiencing diabetes during pregnancy. So in the context of pregnancy, expecting moms can develop a condition known as gestational diabetes, which can pose a risk between the mother and the baby. This type of diabetes can be developed during pregnancy. So guys, kung tinatanong nyo kung when OGTT should be taken, it's not for you to decide. It should be a decision and a recommendation coming from your OB-GYN or your OB. OGTT is usually taken between 24 to 28 weeks of pregnancy. Sa case namin, si Joanne kasi was recommended by her OB on her 26th week of pregnancy. So she got tested, and fortunately, thank God, normal ang mga results niya. So now let's talk about how OGTT is done. So first, we were advised to fast or go on fasting for about 8 hours. When I talk about fasting meaning you are not permitted to eat or drink anything prior to the test. So it is always best to schedule your OGTT in the morning para at least kakain ka ng between 10 to 11 p.m. tapos you sleep all night, and then in the morning, take your examination, okay? Let me just go through the steps for the OGTT exam. Step number 1, you will be asked to drink a larger volume of concentrated solution, that is the glucose drink, about 8 ounces or 237 milliliters, containing 2.6 ounces or 75 grams of sugar. And this is how it looks like. Step number 2, your blood will be extracted and tested every hour for the next 3 hours. So again, depende yon sa resulta. If your blood sugar is already stable in the first, second, and third extraction, you should be advised as done or finished. Okay, wala nang fourth and fifth extraction. So in our case kasi, between the second and the third extraction ni Joanne, her blood sugar was pretty stable already. So, 3 extractions lang yung ginawa sa kanya in the next 3 hours. So you should allocate about 4 to 5 hours for the examination para at least you have an allowance. So guys, during our day of OGTT examination, mukha ko na a couple of clips for a vlog update for you guys as well. Hindi ko lang nakunan si Joanne sa loob ng laboratory because it's not allowed. These videos that I'm going to show you is a little bit discreet kasi bawal po mag-video and mag-picture sa Makati Medical Center. Alright? Insert videos. Good morning guys, today is March 11, time check, it's 7 a.m. Andito kami for a scheduled OGTT para measure yung glucose level niya sa katawan and how well the body will cope to the glucose na papainom sa kanya. So we paid a total of 1,585. Nandun ngayon si Joanne sa laboratory number 24. Iti-take na yung kanyang first blood extraction and then a series of extractions will follow. Binigyan kami ngayon ng copy of the schedules for the next extraction. So first hour is 8:15, second is 9:15, and then 10:15 for the third hour. Specifically nakalagay dito, don't eat, don't drink, and don't vomit. Yun. Tatapusin lang, tapos antay namin yung next schedule for extraction. Time check guys, it's 8:05 a.m. Nanood lang kami ng prison break while waiting for the first extraction. So nandun na si Joan ngayon sa loob ng laboratory about 10 minutes earlier, an hour before the first extraction. Pinainom siya na bottle of sweet drink. Antayin na lang natin si Joanne. She will do the second and the third extraction with an hour interval. Time check, it's 9:15 a.m. Inaantay na lang namin yung last extraction which will happen at 10:15 a.m. So uwi na kami after. Sorry, hindi pa pala kami uuwi. Kakain muna kami kasi pareho kami naka-fasting ngayon. Tapos saan kami uuwi after namin kumain. So for the OGTT, the result will be made available after 6 hours. Form namin and result will be forwarded to the doctor sa OB-GYN. Kami naman, we can also access it through online. Based on experience guys, I came up with a couple of tips for you guys before you undergo the OGTT examination. Okay, number 1 is bring someone with you. Pag magpapatest ka for OGTT, make sure na may kasama ka. Okay? Either someone who will drive you to the hospital or laboratory, or someone who will guide you and assist you after the extraction. Kasi may hilo ka, you will feel lightheaded, you will feel a little bit of dizziness. Kasi, of course, you will have multiple blood extractions. So, it's better for you to be safe kapag pauwi ka na. Tip number 2, expect na magkakaroon ka ng mga pasa-pasa, bruising. You can also experience bleeding because of the multiple extractions, which is completely normal. Okay, some possible side effects also may include vomiting, headache, bloating, and nausea. Ngayon guys, ipapakita ko yung insert ng aming results during the OGTT examination. So yun guys, that's basically our update for OGTT and I hope you guys find this vlog very informative and helpful. Thanks for watching guys and see you in our next vlog. Bye!